My name is Cecilia Mwangi. I work with Kenya Red Cross as the Regional Youth Officer, Central Region. We're here today for the Mental Health Summit. This was quite an informative summit, bringing together different stakeholders on issues of mental health and technology.
My name is Chris Ouma. I work with IREX as a monitoring, evaluation and learning advisor. And so today I'm here to actually share part of the work that we do at IREX with this community of amazing people who are doing work around mental health and young people.
My name is Alex Mavuti, a director at WeFlare. The youth are mostly affected by mental health, and I'm really happy that we've come here today so that we can discuss about these issues on mental health, trying to see how we can leverage on technology and embracing the power of artificial intelligence to ensure that the youthful population has solutions at hand.
I myself have been battling mental illness since 2017, and the journey has not been easy. Because it has been really stressful. My mom was my caregiver. I did something this year to give up. She told me to start looking for my own medication. And that is over 1,000 shillings, and I'm jobless for now. So, I say for now because there's only hope. Please clap! Thank you for the donation. So, medications are expensive. Sometimes the medical services are substandard. But for my case, I became paralyzed in the hospital because of some doctor's misconduct. When they were trying to do a drug test, which was uncalled for, because they just assumed I was drunk. Which apparently is something the doctors do for campus students who are gone crazy. And it's so archaic. So I became paralyzed and I had to be pulled out of school for 8 months. Losing track of my education. By the time I managed to go back to school, my memory was not okay because my bipolar just started kicking in. And no one knew about it. Even when I was admitted at Chiromon medical clinic for 2 weeks, they never told me I had bipolar. They would just pump me full of antidepressants to lower my voice. Okay?
Mental health is a unit, but it has different segments within it. And if we are not careful, we'll continue procrastinating that will work collaboratively, coming up with a consortium that we're talking about. But there is need of mental health family to come together and identify what can we do as a family. Maybe for example, we say Melin Delela's initiative, let's come together and do a one run or a walk that will touch all 47 counties on mental health. And we work together towards mobilization of resources. And this, I strongly believe that with the committee that we can come up with, we can say, okay, this goes to this goes to this. And already we identify teams amongst us which will drive that happens.
And this is an upcoming trend by most of the donors and funders. You find most of them are focusing on interventions that are being made by community groups or community organizations that are addressing interventions at the local level. So it's giving a disadvantage to most of the INGOs, for example, or NGOs that have got intervention at a global or a national scale. So small CSO should take advantage of this. How can you do this? Very easy. There's something called collaboration. Have you heard about it? Yeah. Create a consortium. For example, USAID has rolled out a funding. This is an example. Don't say, I've not seen that funding. For mental health. And in that part, they have put different sectors in there, including climate change. This is one of the areas that my organization has found itself struggling. We don't do so much on climate change. But we partner with other organizations that are doing something that is linked to climate change, including HealthX. HealthX is one of the people I've written a proposal with. And so you partner with those organizations. Maybe someone is handling, what do you call it, the suicide. Another one is handling, what are those components in mental health? I'm not an expert there. The sports, the youth, someone is handling maybe children. So you come together as a group and write one proposal. Then you know how you will decide how you will divide that funding. sign an NDA amongst yourself, sign a statement, an MOU amongst yourself, so that when the funding now comes, you'll be able to implement that as a team, but each organization addressing different areas of their own personal expertise. Also invest in an expert like me, Not everybody's an expert, so please give me some.
Thank you. This is actually simple. So when it comes to climate and its impacts, we need to do three things. We need to plan, we need to anticipate, plan, and mitigate. So what we need to do more in mental health, we need to take a preventive aspect. So a preventive aspect will ensure that you don't have a crisis whereby everyone's mind is a fire everywhere. So we can just get into now the community interventions that can be done, have community centers for education in matters, climate, making people understand why it's important to protect the environment that we live in, because if you don't protect the environment, then these are the consequences that will catch up with us.
So, what strategies do you feel we can employ to reshape the care delivery system, fostering a transition towards comprehensive whole person care?
What we have been doing is we've been doing community outreach in some of these places. We go even in rural places like in Busia. We have been doing a lot of sensitization, especially for mothers who are expectant. We are able to follow up with them until they deliver their children. So we're doing a lot of outreach, telling them how they can be able to reach to us. So that is one of the things that we've been doing. And also now with the social media, especially now for especially young people who are maybe technical, they can be able to get to know about us. But a lot of outreach we have been doing. And I can say that right now we are attending to patients in most parts of the counties.
All our speakers and those who attended, we are really grateful. Those who hear our call and join us today, we are really grateful. May God bless you. Again, to the media team, you've really played a big role in this. We're also grateful for your presence here. The YIDP team, you've worked a lot behind the scene to ensure that the day today is a success. And also, finally, to the host, which is the content team, we are really grateful. It has been an honor to be hosted here.